Hello, everybody just joining us this evening. People are just starting to come in. As you join us this evening, feel comfortable to write in the chat where you're coming from and what your practice area is. We love these events because we always end up seeing people from all across the province and in different spaces. We'll just give people another minute here to get all signed in. Okay, so we are at 7:01. I think that is a great time to kick us off this evening. Welcome, everyone. Joining from Toronto, I'm from Port Hope. I think we've got representatives around Mississauga area, Grafton. Great. So welcome, everyone. My name is Jen Kelver. I am an RPN and a research coordinator at WeRPN. Here with me today is Annette Weirs, our Chief of Nursing Practice and Research. Norma Tomlin, who's an RPN and Director of Professional Practice. Jennifer McCauley, who is our RPN Research Associate. So we are going to be your co-facilitators for today's session with our presenters, Dr. Yoon and Attila Kovacs, who we will introduce in a few moments. It's my pleasure to welcome you all here today with us to join us during our live research webinar. This webinar is being recorded and will be made available on our WeRPN website. The chat feature is active, and we welcome your thoughts and comments throughout our session and our time together here this evening. And during our presentation today, you will be invited to engage in a topic discussion, ask questions, and share stories and experiences. With that, I'll turn it over to Annette.
Thank you, Jen. I'd like to begin the evening by acknowledging the land on which our office is located is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. For thousands of years, Indigenous peoples inhabited and cared for this land. We are grateful to have the opportunity to work on this land, and by doing so, give our respect to its first inhabitants. May we dedicate ourselves to moving forward in the spirit of partnership, collaboration, and reconciliation as we learn together and contemplate the possibilities that lay ahead. I'm just going to go over the agenda for the evening, and we have a wonderful agenda put together by our research team this evening. And we're going to start out with Jen Kelver, who's going to talk about the WeRPN research partnerships and emerging evidence. Then we're going to move to our guest speakers for the evening for their presentation, followed by a fireside chat that will be hosted by Norma Tomlin. And then Jen's going to wrap up with our research updates and our closing remarks. So with that, I'll turn it over to Jen Kelver.
Thank you, Annette. So research partnerships and collaborations are valuable to build an understanding and acceptance of RPN roles, and for RPNs to contribute to driving research evidence that helps to shape our work, our nursing care, and our health outcomes. So WeRPN has external request forms available for download on the website. And this form will ask researchers to provide information about their study and describe their type of request. whether it be they're wanting WeRPN support, in-kind contribution, help with some participant recruitment, or some other requests that they have. Each of these external requests undergo independent review by members of our Research Advisory Council. And the recommended research studies are then reviewed by WeRPN for approval, and researchers are notified of the results, and that launches our research partnership for the approved studies. A 2024 report of survey data with over 1,300 RPN participants showed that a number of nurses revealed their intention to leave the profession or healthcare. Findings showed that RPNs have experienced a significant level of wage compression, resulting from a lack of recognition of the knowledge and skill required in their roles, and highlights those consequences of the reality for RPNs. So this includes pressures on mental health, the impact to patient care, and some troubling workplace dynamics. The WeResearch priorities for 2024-2028 were forged from insights from RPNs, collaborators, and key partners, and were grouped together into 4 categories. And this includes health and safety for RPNs, policy and health services, clinical practice, workforce planning and development. I'm very pleased to welcome our presenters, Dr. Yoon, who is the principal investigator on a partnered 3-year research study funded by the Canadian Institute for Health Research, and Attila Kovacs, who is a co-applicant in RPN in long-term care, and Norma Tomlin, who will moderate this session. Dr. Rosie's research area focuses on health services implementation, and evaluation, with a particular focus in integrated care for people experiencing structural vulnerabilities, inequities, and marginalization. Her research also examines trauma-informed organizational culture and workplace mental health. Her clinical area of expertise is in the areas of substance abuse, concurrent mental health conditions, trauma, and gender-informed care. And we have Attila, who is a dedicated healthcare professional and a researcher with a unique blend of expertise in nursing, engineering, and education. He is a registered practical nurse and is currently pursuing a Bachelor of Science in Nursing at Ontario Tech University. Attila is committed to advancing his knowledge and impact in the healthcare field, and his research focuses on improving care in long-term care settings, with key contributions to the projects addressing dementia care, palliative care education, mental health resilience, and healthcare teams. So with that, I will now turn it over to our presenters.
Oh, thank you so much, Jen. And on behalf of our larger team, Attila and I are thrilled to join you this evening. Thank you all for inviting us to share our 3-year study that is hyper-focused on building psychological safety for the long-term care workforce. And we are looking at implementing strengthening of equity and trauma-informed organizational capacity. And the most thrilling part of this work is we bring together a powerhouse of collaborators, of which WeRPN is a strong partner in our initiative, along with OPSWA and the RNAO. So I'll pass to Attila. There we go.
That's a good slide. Good evening, everyone, and thank you for the opportunity to share our work with our audience today. As Rosie just mentioned, today we have just her and me here, but the project team is much larger, as you see in this slide. I'm not going to read everyone's name. However, I would like to mention the organizations participating in this study. We have several leading industry professionals from Toronto Metropolitan University, the University of Ottawa, Ontario Tech University, York Regional Public Health, and associations like the Ontario Personal Support Workers Association, the Registered Nurses Association, and we also have several members of the WeRPN on the team. Each of these organizations play a vital role in improving the healthcare sector through research, advocacy, and professional development. Now comes the slide that I was introduced before. Yes. Today, we are going to provide an overview of this research initiative that we are working on. We are going to discuss the purpose of this project, the approach we take, and as Rosie mentioned, this is a 3-year-long adventure, so we are going to see the phases and what we plan to achieve during those phases. And we also will provide resources towards the end that we can make available for our audience. Then at the very end, we will have a free-form discussion where you can ask questions about the project. Now, before we begin, we would like to ask you 2 questions just to see what comes to your mind when you hear psychological safety at work. So in the screen, you see the QR code. The Menti code was on the first previous slide, and I will pass the link into the chat. So you can log into Menti, and we would like to hear from you. We would like to know what you think when you hear psychological safety at work.
Yeah, first word popping up, mental health, support. Respect. Yeah, it's coming all in. Mentally healthy workers. Well-being, trust. And so we'll give folks time to put in their responses. Wow, trust just took the middle spot right there. The most popular words will be the big ones. So you see support, trust, compassion, respect, well-being.
We also have a few coming in through the chat. So if someone has a login already, then you can just copy and paste it over.
Wow, trust is standing strong, right in the middle, right there. Support, idea sharing. So this is really interesting. And one of the things we see is, our project is working with 5 long-term care homes. And one of the things that's the biggest hurdle is getting everyone to understand and share a common understanding of what psychological safety is at the workplace. And so it's a wonderful exercise through this word cloud for us to engage in this dialogue. Equitable has taken the first spot. Trust was in the middle. Equitable has resonated to the front. So next we have another word cloud, and you're welcome to take a screenshot of this. And it's a nice activity that you could actually do with your teams. You could as a nice icebreaker to really articulate, what comes to mind when we think, this is a psychologically safe place for us to work, and to define it. So this is wonderful. And everything that comes to the work cloud, it resonates in the literature already on what contributes to a psychologically safe workplace. So we have another word cloud that will advance. 1 second. Great. I'm going to advance to our next word cloud, which is a second question, which speaks to what comes to mind when you hear trauma-informed organizational culture. And you're already in the Mentimeter, so you could use the same code you already have. Awareness. Recognition. Understanding. Lived experience. Wow.
Can everybody still see the word cloud slide?
Oh, yes. Can you see the word cloud slide? Okay. Supportive. Safe. Collaboration. Understanding. And really safe and supportive have really taken the center stage. Cared for. Teamwork. Transformative leadership. Responsive environment. Compassion. And safe is still holding on to the center stage. So that speaks volume. And so we find this interesting because when people hear trauma-informed practice, they really relate to a direct clinical care, providing trauma-informed care to clients. But people find it a little bit of a leap to say, well, is our workplace, is my long-term care home, does it have a trauma-informed organizational culture? It becomes a bit of a stretch. And so this word cloud is a great exercise to kind of forces us to reflect and take a moment, like what is a trauma-informed organizational culture? And the evidence shows it's organizational cultures that realize the prevalence of trauma in the lives of both its workforce and the people we care for, and is able to recognize that prevalence and impact and respond in ways that reduce re-traumatization. And on the heels of the pandemic, which really opened the lid on the secondary trauma that the long-term care workforce was exposed to, we are now at a place where we need to start looking at our organizational culture to look at how do we create workplace environments that are also responsive, promote psychological safety, and create this understanding of trauma-informed values. So it's wonderful that everyone was engaged in this word cloud. If anyone wants to take a screenshot, you're welcome to do so now. But it's a great icebreaker if ever you want to do that in your own workplace, to get talking about, building equity promoting trauma-informed workplace cultures. So we have a couple of more slides to kind of speak about how our research collaboration is trying to plant some seeds and do some implementation research on how we can help long-term care organizations implement practical tools and knowledge mobilization practices to create these trauma-informed, psychologically safe environments. I think there we are. So thank you everyone for joining that word cloud exercise. The purpose and aims of our research collaboration is really to build capacity in the implementations of tools and processes that are equity promoting and trauma informed, to build psychologically safe workplace environments specifically in long-term care. And, you know, basically, in a nutshell, there's a lot of wonderful toolkits. There's a burnout toolkit. There's a trauma-informed toolkit. There's evidence-based guidelines. And these wonderful things land and rest in cyberspace or on somebody's shelf. And what happens is it doesn't trickle down to the people who need it. It's not getting to our long-term care workers. It's not getting to the RPNs, the PSWs, the staff who day to day, and the long-term care leaders. You know, people are overstretched. And so the big gap is, how do we get those tools, those wonderful evidence-based practices and recommendations into practice? And so our research collaboration is focused on that how piece. And we call ourselves personal shoppers. So what we're doing is our research team will tag team with 5 long-term care homes in Ontario, and we will be their personal shoppers in terms of we'll meet with the long-term care leadership, we'll meet with their staff, their frontline staff, and say, hey, what is it that you are needing right now in terms of your pain points, in terms of building a psychologically safe workplace environment, what's already working for you, and what's gonna work? Because maybe some long-term care homes really love lunch and learns, but maybe some long-term care homes don't have time for that lunch and learn. Maybe they have different things that work better. And so we will personally shop, get the toolkits, and then try to figure out how we can land this into practice.
So this is the high-level step-by-step for our project that Rosie touched upon a few things. So first, we start working together with select long-term care staff, including frontline workers, to create practical and supportive workplace solutions focused on equity and trauma-informed care. And then we will actually put these solutions into action and adopt them as needed based on the feedback from those using them. And then we'll gather the evidence on what works and what does not, so we can refine and expand the effective solutions. And then we have some results. We will share the knowledge and best practices across the sector, so to strengthen the mental health and the workplace support. And at the end, we will focus on collaboration among different organizations and stakeholders to improve long-term care for everyone. And we plan to build a toolkit that is really usable, really resonates with the workers on the ground. And this is one of my role with this project, because as a everyday RPN working in long-term care home, I can see the struggles and I can see how it's received, and then I would like to give all my feedback that I can have and provide about these toolkits.
And so our project has phases over the course of 3 years, and we're right now in phase 1, going into phase 2. Phase 1 is engagement. So we've actually identified the 5 specific long-term care homes that we're going to work very closely with, and we're doing a needs assessment with them, like very close with them. What are their strengths? What are their current needs? And then into the summer months, we're going to actually work even closer to co-design. So co-designing is a methodology where you involve the people who will receive or who are the end users of the intervention right from the beginning. Their preferences, their needs, their desires, and to formulate the exact implementation of the supports. Then we're going to implement their tailored supports. And we expect that across these 5 different long-term care homes, they vary in size, they vary in funding model. Some are private per profit, some are municipally funded, and some are very small, some are big. So we did that on purpose because we want to learn how can you implement best practices under different situations. And we're studying what are some common secret ingredients that make things work, like necessary, and what are some variations. And then our last phase is sustainment. So the worst type of research, I think, is when you do research to people and about people, and then you suddenly disappear. And that knowledge is somewhere. We don't know where. So we don't want to do that. What we want to do is over the 3 years, build capacity with each of these 5 long-term care homes, that they come out with greater capacity and support, and they don't need us. They don't need the personal shoppers. They've got what they need. And even better, we hope that these 5 long-term care homes will create their own community of practice over time. So with each other.
So as you see in this slide, we already have a collection of tools and resources that we can share with the interested parties. You don't have to write these down. We can share with the audience after the webinar. And if we advance the slides, we would like to highlight one very handy resource from our own Jan Calver about recruitment and retention of RPNs. This piece is available from WeRPN's website, and it is a very useful document to have to read and implement its content. So if you are interested, Jen probably will be able to answer questions regarding this document at the end when we will have the free-form discussion. And the next slide is, again, a few more links that you can read through. And again, it will be available at the end of the seminar if you wish, so you don't need to write these down. And this is the starting point of our toolkit that we plan to put through the test and add more as they come available. And at the end, we will have a nice refined list of very useful and actually on the ground useful tools.
Hey, Attila and Rosie, we have a question in the chat about these resources that you're speaking of right now. The question is, are they located all over the province, or are they centered to Toronto?
Great question. So no, they're not centered to Toronto. So they're broad toolkits. And so they're intended to provide like a summary of the best available evidence on that subject matter and some practical ways that you can implement it in your place of like environment. There is a difference though. The first slide summarizes the long-term care specific tools, which we think are very relevant to long-term care settings. And then the second set of resources are related to workplace mental health, trauma-informed organizational culture, and burnout, which are from the healthcare sector, but it's not specific to long-term care, but includes like acute care and community care. Oh, and then a plug. So we are part of the Canadian Health Workforce Network. We'll put a link to it. If you are interested in research about worker well-being and the health workforce in general, and I assume you are because you've logged on a Monday evening to this webinar. I'm preaching to the choir. The Canadian Health Workforce Network has wonderful resources, and they have a webinar coming up. Presented by our colleagues from our team, and it's called "Are You Feeling Burnt Out?" And what they're sharing is their research and findings on a set of bilingual strategies, bilingual in English and French, tailored to supporting worker mental health.
So I think this is the fireside chat element of our webinar this evening, and I'm going to jump in. Again, I'm Norma Tomlin here from Professional Practice at WeRPN. This is really a wonderful project, and I am personally very happy to be part of it and excited about the work that's coming out and will be coming out of the piece of work that Rosie's leading. I think it's very important. WeRPN has a voice here. Long-term care is an area, a sector where many RPNs work, and I know this work is going to be very important to everyone in the long-term care sector. A question before some questions come in. Attila, as a member of the research team that's involved in this work, can you share your perceptions as an RPN and with being involved in this research? What is your overall RPN research perception from what's happening with this particular project?
Thank you for the question. As you already mentioned at the very beginning, and I think it was Jen, I'm an RPN working at long-term care home, and I also an RPN doing research. And oftentimes I see a gap, a bit of a disconnect between the research and the application, as Rosie just mentioned, that we have all kinds of research sitting on the shelf and nobody is using them. So my role is to make sure that there is no disconnect. There is connection between the results that we put out and at the end it's not going to sit on a shelf, but we would like to provide some really useful tools that will be applicable for the RPNs, PSWs, RNs in their daily lives, so they can actually use them. They can flip through if it's a chart. They can read through and they can get information out of the toolkit that we will put together at the very end.
Yeah, having something useful that's tangible for them at the point of care to support them. Absolutely. I think this is going to be key for this work. Now, the question that came in, I think, Linda, this is, I think, the second part of the first question where she was asking about the geographic areas. She's asking, are the 5 homes Toronto-based or over the province to show the different geographic areas?
That's a wonderful question, Linda. So we ended up getting a good variation. One of our homes is in North Bay. Another is in Ottawa. And we have a couple in the regional municipality of York Region, which is kind of like the top end of the GTA, and one in Peel Region. And so we couldn't cover the whole province to spread out, but one of the things that is interesting is all 5 homes, although they're different in terms of size, some are municipally funded, some are private for profit, they share in common. One thing is they're keeners. And so that's one thing. Keeners meaning they're already superstars. Superstars meaning they have identified as a home that psychological safety is a priority for them, that they're willing to dedicate the 3 years of collaborating with us to implement supports. And I think that has been kind of the most important secret sauce as a research team that we have kind of shed light on. And so I think for future research, our research is researching the high performers, even though they're understaffed and overstretched, they're at the table because they're saying our workers are suffering. This is something that we need. We value them. And so that's a key thing that has resonated from all 5.
And thanks for that, Rosie. Just maybe can add here or elaborate if you could for our audience. At the end of this project, what are your plans for implementing the outcomes of the research, and what overall do you hope to accomplish?
Great question. So the main thing that was driving this, as Attila articulately kind of put out there, is that we don't want these toolkits and evidence-based kind of recommendations, even policy recommendations, to sit on shelves. And so through our work, we want to share the how piece. The how is in order to get this into the hands of the people who need it, which includes long-term care administrators, the supervisors, the managers, and the workers, and create a culture, demonstrating through our work that it does require an intentional kind of implementation approach, meaning really practical solutions. So Attila mentioned toolkits, but also, you know, some organizations use huddles. Some people use champions models. Some people use micro-credentialing. So that is one element. Our motto is, let's not reinvent the wheel. Let's use existing wheels. And number two is really spotlight the importance of building psychologically safe workplace environments. And I want to use an analogy. During the pandemic, we were hyper-focused on PPE, you know, getting people PPE, having a shortage. And I want to use that analogy for psychological PPE. So kind of pivoting our attention to, you know, the daily kind of psychological impacts of our work, the things that we carry home with us, those very things that are driving our nurses to want to consider leaving our profession. We're at a kind of threshold where we have to critically say, what kind of workplace environment do we want that creates a culture that prioritizes putting on your psychological PPE, so that you know, equal emphasis is placed on that. So at the end of this, the key takeaway is we want to demonstrate through our work with these 5 exemplar long-term care homes how this can be done, how to create that culture, and to spread it. And I think WeRPN, being at the table from the beginning, and with Attila as an RPN researcher right at the table at the beginning, is the key change agent. Because if we continue to do research about people without having the people we research about lead it, it just won't work. Yeah.
Yeah.
That was a long-winded answer. I'm so sorry.
No, not at all. Not at all. That actually leads me into another question. Could you tell me more, or tell us, the audience, more about the team members and their roles and contributions towards the work, especially considering that there's multiple roles and multiple teams that are involved in this important study? Just curious to, I don't know, Attila or maybe Rosie, who would like to take that one?
I think Rosie knows more about the team
Okay.
members than I do, but
Well, no, so we are truly collaborative. And so we have our, we call our organizational partners. So WeRPN, OPSWA, RNAO, and our organizational partners are kind of our knowledge professional organization network. And I think this is a strength to our project because at the end of it, we want to translate our learnings through these networks. And we have a researcher component. So we have researchers from Ontario Tech University, TMU, and graduate trainees who are training their PhD work and graduate studies in workforce mental health. And we have workforce members like Attila and leader members. And it's really all hands on deck. I would say we're kind of a non-traditional team. I think I see Jen smiling and Norma's on the team. We really are a team. And I think that speaks volumes of how research can be done. Research does not have to be stuffy. It doesn't have to be top down. It can be done differently. And I think our team, I'm so proud that I feel that we kind of work in a trauma-informed way, perhaps, you know, and it's wonderful to be a part of this team. Attila, like, I'm gonna open it up to you.
Yeah, I just want to acknowledge what you just said. I remember when I started to get involved with research, I had some idea about research, and I thought that it's done at home in your solitude, and then you work, and then at the end there will be results. And over the years, I had to learn that it is really, really a team sport. So it is way better if we play together and everyone pulls their own weight in their specialty area, and they contribute to the greater good. And this team is really diverse and very knowledgeable, and I'm very happy to be part of it.
Yeah, well said, Attila. I would have to say, and also with acknowledge here the leadership within this team and Rosie's leadership. And I commend you for taking the leadership role that you have with this very important work. It couldn't be done without somebody who's as passionate about this work as you are. And yeah, we're very pleased to be part of it. That's for sure. We've got a comment in our chat from Linda. Linda says, so glad this research is happening. It's so important, and essential. We need to keep our nurses emotionally invested in caring for themselves and their patients, residents, and as for retention in all nurses, PSWs, etc., including nursing students, which she's absolutely right. We are trying to entice into the profession. We absolutely need to take care of the nurses coming into this profession and those that we already have in there. Well said, Linda. Now, of course, the chat is open for any additional questions that anybody might have. So please feel free to put your questions into the chat, and we'll have Rosie and Attila respond. We'll give a couple of moments. Maybe there's a couple of more questions coming in. So we do have a question here. Any tips for employers to encourage and open the dialogue amongst staff? Great question. Maybe
Well,
Rosie?
yes, and Attila, please, interrupt anytime. But absolutely, I think one of the things the existing research shows is that the pivotal role that nurse managers, supervisors have in creating psychologically safe environments, and in terms of what can a leader do to start to engage in it is one. I think one is having that dialogue, checking in with people, using the terminology, we value psychological safety, and creating ways to have this dialogue. And it could be as simple as what we did earlier in this webinar, like a Mentimeter, get people talking. And you'd be surprised, I think in this field of work, the term psychological safety, trauma-informed, is ambiguous. And so starting of level setting of what do we mean by that? Like, and the number one thing people hear when they hear trauma-informed is they think trauma, like I don't have PTSD. So it just ranges. So as a leader, kind of setting the tone, level setting, have a common shared definition. And there are wonderful resources. So there's the Trauma-Informed Toolkit by the Substance Abuse and Mental Health Service Administration. There's also toolkits from our Healthy Worker Toolkit from our Chuan partners. And number two is supervisors and leaders also need support. And that is another gap because, you're kind of sandwiched in the middle. You're holding up the team while also holding up things that come from all directions. And we found in the literature that there's not enough support for leaders. And so I think somebody mentioned the work, transformative leadership skills, relational leadership skills. Those are things that leaders need support with. And so it turns into a bigger thing, not one individual, but as an organization. And I would say a leadership team at the director level, at the management level, tabling as an initiative that goes beyond one leader is a great strategy. Because now it's everyone's skin in the game rather than you holding up everything. Attila, what do you think?
I would just like to add one thing to this is that we definitely need to start the conversation rolling because I still feel that the psychological safety has some stigma attached to it in the long-term care homes. So if you work on a shift, you pull your leg or your muscle, you go to the doctor, you get the painkiller, you get the treatment, and then you're done. If it happens something that it's not related to physical health, nurses tend to just shrug it off or brush it off or not, or deal with I'll deal with it later, or oh, I can deal with it, or they just don't say anything, and that's even worse. So we definitely need to get this conversation started and get all the information that we can from nurses, because we need that. We need to show that we are here, and there is support, not only when you pull your back, but if someone tells you something that you didn't really want to hear during that shift.
Yep, Attila hit it on the nail, right? There's so much stigma existing regarding talking about psychological safety and risk, and getting that conversation going is so powerful.
So I'm just going to actually change that question around a little bit. I know it was regarding the employers, but what about the staff? Any tips for staff to start that dialogue with their employer? Just a thought on that.
I would say the first and foremost is just don't be shy. Don't be shy. Start the conversation, and everyone has to learn that even though it looks like, they are not alone. They are not alone because this problem exists. It's there. It affects multiple nurses, not just one. Likely in your home you have more than one. And if you don't say anything, help won't be available. Nobody can help you. Nothing is done if you just don't talk about it. So just please start talking about it. Share your experience, share your needs, and then the solution will be available.
Absolutely. And sometimes a nice icebreaker is like tools. So you could actually say, you could send them, you could say, I went to a WeResearch webinar on Monday evening, and they talked about this thing called psychological safety. And honestly, that's like your coffee table book, or the resource that WeRPN made recently that we just shared, that Jen led, and say, did you see this? It's kind of is an icebreaker. Or I hear, there's a long-term care best practices toolkit. There's a health worker burnout toolkit. Have you seen this? But most importantly, how many of you here have heard of the 13 factors? Yeah, just like I know I took the poll down. I'm like, raise of hands, but like, you can say to your manager, have you heard about the 13 factors? And it's the 13 factors for psychological safety and well-being at work. It's a national standard across Canada. And every HR department probably knows about it because it is a workplace standard. And so things like that. So then it's not about like, oh, me. It's about, it's a workplace standard. So, we have a workplace health and safety committees that look at ergonomics, if there's electrical stuff hanging out or wet floors. Well, we have to start looking at psychological safety in the workplace, just like the same thing we do, right? Do we have debriefing? Are we exposed to distressing events, and do we have mechanisms and policies and processes in place to support that? So I think somebody put it in the chat, but the 13 factors is a great icebreaker. And also talking about it, to Attila's point, because so many of us I'm a queen of crying in my car. I will get in the car, and before I drive away, I will cry and then go home and then repeat and go to work. And so I can't cry in my car anymore. So one of the things is and I know, as Attila said, I'm not the only one, right? We're all kind of doing it separately, and breaking that silence is the big piece.
During the research, so I'm going to jump in if you don't mind, Norma. I'm listening to the discussion here with Rosie and Attila and Norma, and it's making me think of the discussions we had at the research symposium around psychological safety. And a lot of the attendees were talking about, I guess, having those conversations in the workplace, knowing that they won't always be comfortable, maybe in that moment, but having a safe space to have those conversations. So do you have any other advice for nurses or managers who might be experiencing that hesitancy to start those icebreakers, or to start looking into those 13 factors?
And so that's a great question, because, you know, it's hard, right? It depends on the many constraints and the context of the workplace environment. I call it water under the bridge. So it depends on how much water is under that bridge. And taking a trauma-informed lens to these difficult conversations often helps. And what I mean is, from a trauma-informed perspective, you shift a bit. You shift from being reactive. So reactive is what's wrong with the situation, to shifting towards a curiosity to what's happening. And sometimes what we may be seeing are some behaviors that are shutting down. People are shut down. People are tired. People are overworked. We don't know what water's under that bridge. And those things build a environment where you feel like you just can't say anything. Having said that, I'm hoping that a trauma-informed lens to these types of situations helps us to create some space within ourselves and within the context to have curiosity. And that curiosity so helps me or us to shift away from being reactive, like what's wrong, what's wrong, what's wrong. And there could be many things wrong, for sure. You know, we're not Pollyanna, but to shift it away to being more responsive and saying, you know, what's happening here? And that happening, that curiosity, kind of creates that space to, you know what, there might be a different way, a different opportunity for me to approach this. And I know it sounds kind of airy-fairy, hokey-pokey, but it's really kind of trying not to have that knee-jerk reaction. But we're all in this together. I really believe that. Nobody wakes up in the morning and says, I'm going to make somebody's life difficult on purpose. Nobody does. I think it's a sign of suffering. And, you know, when you pivot that way, you find that window of our opportunity. What do you think, Attila?
I agree absolutely with you. I just want to add one more thing to the going home and crying in the car scenario, because we nurses have the obligation to deal with this, or at least I feel like it, before I go home. Because if I take everything home and I dump it on my family, it's not a good scenario. So I need some way or form to either vent or process the events, and have some tools that available to me, that I'm not relying on my family to comfort me and solve all my problems, because they have their own problems, and family life and work life is not always completely separate, but it should be to a certain extent. And the families is they have their own problems, and when you go home, you are a father, you are a mother, you are a husband and a wife, and that's a different role, and you shouldn't take the burden from one role to the other role, because it creates tension, it creates more problems, and we do need a solution.
Those are beautiful, beautiful words. Thank you so much for this important conversation. I'm just noting the time here, We have about 5 minutes left to the end of our webinar, and I'm sure everybody is ready to tuck in, maybe on their Wednesday evening or Wednesday. I'm jumping ahead in the week. What happened there? On their Monday evening. Wow, this is going to be a very long week for me if it's. But I want to go ahead and take a few moments to share a little bit about what's happening at WeRPN Research. If you have any questions for our speakers, I mean, we're happy to connect you and forward your questions to them. I'm seeing there's some more resources that are being added to the chat, and we will share them through your emails as well after once the session is completed. Okay, so before we close for the evening, we'll just give you some of those brief updates. There's lots happening at WeRPN in their research program. One of the first ones we'll share is we run 4 quarterly research webinars each year, and we like to provide updates on these different projects that are happening. So Dr. Denise Conley's research lab out of Western University is leading a large research program around the Bridging Education Grant in Nursing, and they have 11 studies ongoing, and a lot of these studies are in their final phases. The team has shared 2 publications that are out there available now for you. They have 2 publications, and actually that number might be a little bit higher, that are currently under review. And they're sharing this work at national, provincial, and organizational workshops to bring people together for this work. So we'll stay up to date and we'll keep sharing information with you as it comes forward. We just heard from Dr. Nicole Gattar last week at the Educator Summit. And there is so much wonderful work being done around the transition to help nurses transition into their new roles. We have 7 WeRPN research grants this year. Typically, there's funding for 4, and this year there was the ability to fund 7 grants. All of these research teams submitted their midterm reports, and they've reported that they're all on track. The majority of these studies are in the recruitment and data collection phases. We had 2 studies share that they had a little bit of a delay with their REB, but they feel confident that they're going to be able to get back on track. And we did have 2 other studies share some preliminary findings. And so we'll keep sharing that information with you. Our research fellows, we had 3 research fellows this year, and the research fellows are all moving along their projects quite well. And they've reported some of the benefits to them as research fellows. So they shared that being a research fellow has helped them with critical evaluation of research evidence for relevance and applicability, helped them around strategic thinking and organization and project management, and also helped them with communication skills that they found translate into their professional practice, and giving them a deeper understanding of research ethics, the consent process, and confidentiality. And each of the fellows that they're very excited about moving forward with the practical aspects of their research studies as they continue to unfold. We have 5 research partnerships ongoing right now, and each of those studies are shared with us that they're on track. We have 1 in active recruitment, and they're putting together an advisory group. We just heard from Dr. Rosie and Attila on their study where they're co-developing and building relationships with long-term care partners. We have another researcher who's preparing for recruitment. And then we have 2 startups that are diving into the literature and looking at information to get their projects kicked off. We have supported 8 participant recruitments. We have 5 in progress right now, so please watch our social media, our Pulse membership newsletters, and our bi-monthly research news for opportunities to share your voice and to participate in research studies. We heard from everybody here tonight how important it is that we hear from what's happening at that point of care and, across organizations, education, and research. At the beginning of the webinar, I shared that our Research Advisory Council members review all of our research requests. Each of these RAC members serve a 2-year term, and the call for statement of interest is now open. for an academic college rep, a public representative. So this could be a client or a care partner, somebody who's received care from an RPN representative, and a member at large. So you can submit your statement of interest to join us on our website. And with that, I'm going to turn it over to Jen.
Hi everyone. So it's just to also remind you that our calls for the academic research proposals are open as well. The deadline to submit is at the end of this month, March 31st. We have 4 one-year grants available with up to a maximum amount of $25,000 per grant. And you can apply online through our website, and there you'll find the templates and resources to help you guide you through that process. Additionally, we also have our calls for the RPN fellowships open, also for the 25 and 2026 year. The deadline is the end of this month, March 31st. There are 2 fellowships available for up to $12,500 each for those. That funding is for the time spent in their research activities for the RPN. And this also includes free enrollment into our WeRPN Introduction to Nursing. It's an online course. It's a course I took. It's an excellent course. It offers a lot of resources, provides a great foundation for nursing research. It covers the fundamentals of research and concepts, provides step-by-step guidance through the research process. I found it wonderful for my learning. Attila as well had taken the course here as well. So that's involved in the fellowship. And there's, again, online instructional video for more information and how to apply for that as well. And I will turn it back to Norma.
So we can't close a WeRPN webinar without talking about the importance and benefits of your WeRPN membership. There's numerous benefits to being professionally engaged. So for those RPNs that are not members, please ensure that your membership is active so that you can ensure that you have the professional liability insurance that you have that comes along with your membership. Very, very, very important. In addition to all the other wonderful benefits that you receive from professional practice, career development, the We Learn webinars that you have every month that are open to membership, mentorship. You become a voting member for our governance of our board of directors. And so just stay professionally engaged, keep your membership active. It's very important that you maintain consistent insurance coverage in the event that you require it. And of course, there's a QR code in case you need to be updating your membership. With that, of course, students, if there's any students that are watching, please get professionally engaged. The sooner you get professionally engaged with your association and launch your career into practical nursing with WeRPN beside you, the more the advantages you have. So again, all the information is on the slide. You can visit our website as well, and certainly use the QR code to join. For those of you who are not RPNs and not students, but friends of WeRPNs, there is an associate membership that is available. It is available through our website as well. So please take a look, and certainly friends of WeRPN can be actively involved with our association. So I'll leave that with everybody this evening.
Thank you so much, everybody, for being here with us tonight. You know, there's many ways to stay up to date on the research activities, events, and opportunities at WeRPN. So with this, we'll close our session today. We would really, and we can't do it enough, like to express our gratitude to all of you for taking time out of your day to join us this evening. And a special thank you to our presenters, Dr. Rosie and Attila, for the insightful presentation on building psychological safety in long-term care. We are very honored, as Norma said, to be a part of this research and this work moving forward. And we'll keep our members and our friends up to date as the research continues. It takes all of us to put forward an effort to strengthen the health workforce in the system so that we can deliver safe and quality person-centered nursing care. So with that, we thank you and have a wonderful evening, everybody.